Hello everyone, this is Dr. Shilpa Madapati, Obstetrician and Gynecologist, Infertility Specialist and Laparoscopic Surgeon in Dr. Shilpa Women's Clinic, Kondapur. Today, I would like to discuss about the nuchal translucency, NT scan and double marker test in pregnancy. Importance of NT scan and double marker test in pregnancy. Some people usually in a pregnant woman, when the pregnant woman walks into the hospital and when we people advise about the ultrasonography, they think that ultrasonography is dangerous to the baby. Will it be the harmful to the baby? So people will ask us. I would like to clarify that ultrasonography is the safest investigation, and the thing like necessity of ultrasonography also I'll tell you. Necessity of the ultrasonography in early pregnancy state, like in first 2 months period, we have to know about the number of pregnancies, number of fetal babies, and how many weeks of pregnancy and place of the pregnancy. Very importantly, place of the pregnancy. So the pregnancy, what is the difference of place of pregnancy? Pregnancy is will be in the uterus only, right, ma'am? Some people will ask this question. It is not like that. The pregnancy will be in the two different. One is normal pregnancy, another is abnormal pregnancy. The normal pregnancy will be, normal pregnancy means the pregnancy within the uterus is considered as a normal pregnancy, which can be visualized after 4 weeks of the pregnancy through ultrasonography. And before that, we will not be able to see through the ultrasonography. We will be able to confirm through blood investigations or urine investigations. So abnormal pregnancy is the thing like when we confirm the pregnancy through urine and blood test, we have to see the pregnancy through ultrasonography after 1 week. That is must and should to confirm the location. So sometimes the location of pregnancy may be outside the uterus also. So outside the uterus, when the pregnancy is deposited, it is considered as a ectopic pregnancy. So for most of the people, 2 out of 10 members, we generally see ectopic pregnancy. Very rarely we see ectopic pregnancy. But still, the confirmation of pregnancy is must and should in an early pregnancy. If it is in an abnormal position, we have to take the action as soon as possible to arrest the rupture of the pregnancy. And to rupture of pregnancy is like internal bleeding. It may lead up to shock in a pregnant female. So this is the thing. This is the necessity of ultrasonography in a first 2 months of pregnancy, and to know about the fetal baby heartbeat and how much rate it is, and the heartbeat has formed or not. If the heartbeat is not formed by 8 weeks, we have to reassess the heart rate of the baby to look about the healthy status of the pregnancy. And in view of that, doctor will advise you the extra hormones to get the heart rate in a good manner. And the other thing is like NT scan. People will ask why the doctor is advising the scan in the second month, and again they are asking to go for the scanning in the third month. Why these people are making unnecessary investigations? People think in that way regarding, thinking in their view. They ask the doctors mostly these type of questions. So the second month of pregnancy, we do the investigation scan for the location and for the heartbeat. In the third month, at around 12 weeks of pregnancy, we generally advise NT scan and double marker test to rule out the chromosomal abnormalities and the genetic wise brain abnormalities. So to rule out the genetic wise disorders and brain defects, NT scan is the early marker to differentiate the things. So if the NT scan is normal and double marker is under a low risk category, then this abnormalities and detection will be out of 98% complications will get. 98% of the abnormal babies will be decreased. This can't be done after 13 weeks. This can be done within 11 to 13 weeks in between period only. After that, we'll cross the NT level, and the NT measurement we can't consider it. And only depending upon the marker test, double marker in the sense the 2 blood investigations will be there. So accordingly, age of the pregnant woman and number of pregnancies, everything we'll consider it and categorize the abnormalities regarding genetic disorders. So these can be done in a specific period. That's the reason we generally advise it around 12 weeks of pregnancy. So try to understand the necessity of the ultrasonography and go according to your doctor to know the things early stages and to go for the treatment in wise. Today I'd like to end this topic, and in an advanced video and next video I would like to tell about the other subject. Thank you. Have a good day.